Was the COVID-19 pandemic avoidable? That's a question many are pondering as the virus is taking thousands of lives every day. Such reflection is necessary as it enables us to be better prepared for the next public emergency. But sadly, it is in turn being used by anti-China forces in the US to deflect blame.
We've worked too hard and we fought too long to lose it to a Wuhan. That's what I said, a Wuhan virus.
The virus grew to a pandemic because Chinese officials silenced health authorities in that country who tried to warn the public about it.
Took away our chance to potentially stop this from becoming a global pandemic. They need to pay for that.
The reality is that we could have been better off if China had been more forthcoming.
Whenever there is a disaster, we tend to look for someone to be held accountable. But this time, it seems that the US has got the wrong one. The reason America is one of the hardest hit countries by COVID-19 is not because of China's cover-up. More likely, it is because of the White House's delayed response when there were warning signs from the outset. In late December, cases of pneumonia of unknown cause were first detected in Wuhan, capital of central China's Hubei province. 3 weeks before the lockdown, on January 2nd, China started the virus identification work. From the next day, China began to inform the WHO and exchange information with the US regularly about the new virus. On the same day, the potential threat of the new virus began to be included in Trump's daily brief. From January onward, as China was busy tracking the spread of the virus and developing test kits, the volume of warnings also increased from US intelligence agencies. It was about the same time that Senator Richard Burr sold as much as $1.72 million worth of stocks. On January 21st, the first coronavirus case was confirmed on US soil. However, the sense of a looming crisis in the White House did not seem to alert high-level officials and Trump.
We have it totally under control. It's one person coming in from China, and we have it under control. It's going to be just fine.
On January 23rd, Wuhan, a city of 11 million people, went under lockdown. A national battle against the new virus had officially started. Scarred by SARS 17 years ago, everyone was in a wartime mode. Don't forget, even then, some Western media outlets were still questioning China's method, calling the lockdown excessive and a violation of human rights.
Western nations knew after Chinese New Year the impact that COVID was having, the lockdown in Wuhan, etc. They knew this was a serious problem. So why were they not prepared? They knew what was happening. China wasn't covering up. And in fact, China let the genome of COVID virus be known internationally as soon as it was known within China.
At the end of January, the US reported its first person-to-person transmission case. The next day, it closed its borders to travellers from China, which seemed to be already good enough. However, the critical window was lost, a window that could have been used to produce more qualified testing kits and plan a more coordinated strategy.
Coronavirus is not going to cause a major issue in the United States.
The first batch of patients infected by the virus is now being transferred to the Leishanshan Hospital. It is one of the 2 newly built facilities that are dedicated to treat the patients.
The virus. They're working hard. Looks like by April, in theory, when it gets a little warmer, it miraculously goes away. I hope that's true.
In the meantime, China says it's mobilizing a further 20,000 medical staff from around the country to support Hubei province.
So far, the city has opened 9 makeshift hospitals. Together, they can provide about 7,000 beds.
The window of opportunity is still there, but our window of opportunity is narrowing.
Whatever happens, we're totally prepared.
There's a case in your district where it's not explained because they just came from China or they were with somebody who had traveled. Do we have that part right?
That is correct. They call it a community infection or community transmission.
So far, all the designated hospital has already have more beds than the patients. The saying is their beds are waiting for the patients rather than the patients waiting for beds.
Well, I think the 3.4% is really a false number. Now, I think the number, personally, I would say the number is way under 1%.
If you're under 50 and you're healthy, which is most New Yorkers, there's very little threat here.
It wasn't until mid-March that the White House started to take this more seriously and announced a national emergency. The public was warned and schools were closed, but an outbreak was inevitable. As the CDC failed to coordinate testing kits, many more patients who were not aware of their infection continued to spread the virus.
Did the CDC screw this up?
Well, the CDC's test didn't work. They shipped a test that was faulty and they had to recall it. That we lost critical weeks. We lost some critical weeks. We lost about 3 critical weeks.
Looking back at the timeline, anyone could say, if China did this at this time, things could have been better. But don't forget that China entered uncharted territory and started the battle on its own. Other countries had a choice. The group of people who accused China of being responsible for the pandemic are the same ones who played it down in the first place. The past is history, but the US can still seize the present to treat more people, instead of spending every effort to find a target to blame.
Western nations are eager to blame someone for their own mistakes. America in particular, they knew about this in mid-January, but they really did nothing until they started to see an increase in infections in the recent week or two. It was world news. It was headlines for days and days and days. And yet, many countries sat back and said, oh no, we don't need to really worry about this. It's purely a Chinese problem. So it's very important not to blame China for mistakes that Western countries have made themselves.